Namaste Bitiya. Hamesha khush raho. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science, JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's lecture, we are going to start with the examination of nervous system. We will start with the introduction. What are the different symptoms for which a patient is coming to you, and how we will examine the particular patient of nervous system examination. So let's start with the examination. Whenever a patient visits the physician for the following CNS complaints, you need examination. The symptoms of higher functional disturbances like change of mood, memory, change in memory, change in orientation, consciousness, insight, etc. The patient is having constant headache and vertigo or syncope. Changes in the disturbance of higher functions like change of mood, memory, orientation, consciousness, insight, headache, vertigo, and syncope. Change in the motor systems like paralysis. If a patient is coming to you for paralysis, then you have to examine for the CNS. Weakness of the muscles, atrophy of the muscles, when the muscles are getting atrophy. Involuntary movement, any kind of involuntary movement, especially in case of Parkinsonism or other diseases, then you have to check for the CNS involvement. Changes in the sensory symptoms like abnormal or loss of sensations, you have to check for the sensory symptoms. In the motor, you have to check for the paralysis, weakness of muscles, atrophy of muscles, and any kind of involuntary movements. Sensory symptoms including abnormal or loss of sensations. The general physical examination includes the examination from head to toe. In CNS, we have an examination of the head and scalp for size and shape and any kind of neck stiffness. You have to check for the size and shape of the head, whether it is enlarged, especially in case of hydrocephalus, or shrink, ankyphally and encephaly, or you have to check for the neck stiffness, especially in case of tetanus. The skin. In the skin, you have to check for navius, any kind of hemangioma, sebaceous adenomas, bleeding spots, infections like herpes and HIV. The eyes, including the fundus, you have to check for the mouth and oral cavity. You have to see the ear, nose, and paranasal sinuses. So, in the general physical examination, you need to see the head and scalp for size, shape, and neck stiffness. In the skin, you have to see for the navius, hemangioma, sebaceous adenoma, bleeding spots, infections like herpes and HIV, eyes including the fundus, mouth and oral cavity, ear, nose, and paranasal sinuses. In the neck, you have to check for the lymph nodes, lymphadenopathies, for the thyroid disease like goiter or multinodular goiter, any kind of carotid bruit or bruit in the thyroid. In the axilla, you have to check for the lymph nodes, any enlargement of the lymph nodes. You then have to check for the extremities. In the extremities, you have to check for the posture. You have to see if there is any presence of scoliosis, kyphosis, kyphoscoliosis, or the lordosis. You have to check for any kind of spasm or cramps, any kind of deformities, especially swan neck deformity, wrist or foot drop, wasting of the muscles, any kind of abnormal movement, especially in Parkinsonism or edema of hands and feet. You have to check the neck for lymph nodes, cervical lymphadenopathy, or left supraclavicular lymph nodes, enlargement, thyroid disease, carotid bruit. In the axilla, you have to check for the lymph nodes. In the extremities for the posture, spasm, cramps, deformities, wrist and foot drop, wasting, abnormal movements, and edema. In the finger, you have to check for the koilonychia or the club-shaped nails, any kind of disorder, especially in the nails. You have to check the arms for any kind of pallar, the skin. You have to check the back for scoliosis, the winging of the scapula, the tuft of hair, and you have to check for the gibbous or the spinal deformity. So you have to check the fingers and the nails. You have to check the back for scoliosis, kyphosis, lordosis. For winging of the scapula, the tuft of hair, capillary tuft of hair, the gibbous or the spinal deformity. These are the various things for which you have to check. You have to check for the cranial nerves, higher cerebral functions, papillary edema, speech, motor functions for wasting, fasciculations, abnormal posture or movements, tone, coordination, tendon reflex, abdominal and plantar reflexes. The stance for posture, Romberg sign. You have to check the gait for arm swing and tendon. You have to check the stance, posture, Romberg sign. In the sensory, you have to check for the pinprick, temperature, joint positioning, vibrations and tactile localization and 2-point discrimination. You have to observe for the appearance and expression of the face, the build, the state of clothing and the personal hygiene. You have to check for the posture, gait and abdominal movement, the nutritional status of the patient, whether he is undernourished, malnourished, overnourished, that is obese. You have to check the vitals, that is pulse, blood pressure, temperature and respiratory rate. In the systemic examination for the central nervous system, we have to check for the higher cerebral functions, for the appearance of the patient, mood and behavior of the patient. We have to check for the emotional status of the patient, check for the memory and the intelligence, orientation, delusion or hallucination if that particular patient is having, the consciousness level, whether it is unconscious, conscious, and if he is conscious, whether he is attentive or non-attentive, and released reflexes. So in the higher cerebral function, we have to check for the appearance, the mood and behavior. We have to check for the emotional status, memory and intelligence. We have to check for the orientation, delusion and hallucinations, consciousness, released reflexes. Then we have to check for the speech and the language. How's the speech? Whether he is stammering or speaking fluently. The language, what kind of language a particular patient is using. We have to do the cranial examination, cranial nerve examination of 12 cranial nerves that I have already discussed in another video lecture. So we have to check for the speech and language. We have to do the cranial nerve examination 1 to 12. Then we have to check for the motor function of the patient. We have to check for the wasting of muscles, fasciculations. We have to check for any kind of abnormal movements, the tones and strength or the power of the muscles, coordination of the muscles, and reflexes, that is superficial, deep, and plantar reflex have to be checked for. With the motor function, we have to check for the wasting or fasciculations. Abnormal movements, we have to check for the tone, strength, and power, the coordination of the muscles, reflexes, that is superficial, deep, and plantar reflex. In the sensory system or the sensations, we have to check for the pinprick, light touch or temperature. We have to check for the deep touch, position, the vibrations, and stereognosis. We also have to check for the tactile localization, 2-point discrimination. So, in the sensory system, we have to check for pinprick, light touch, temperature, deep touch positioning, vibration, stereognosis, tactile localization, and 2-point discrimination. In the autonomic functions, we have to check for the standing test for postural hypotension. We have to check for the hand grip and Valsalva test, and we have to check for the other test. So in autonomic function, we have to check for the standing test for postural hypotension, hand grip and Valsalva test, and other tests. Then we have to check for the gait and posture of the patient. Gait is the chart. We have to see for the arm swing, the tendon, that is heel to toe, how the heel and toe are touching, and we have to check for the Romberg test. Romberg test is very important from clinical point of view. Now, how to diagnose the given clinical condition of a neurological system disorder? We have to see the site of lesion in the CT scan or the MRI. We have to check whether what is the site of lesion, because in brain a particular part controls particular functions. So if we have a lesion in a particular part, then accordingly the function will be lost. We have to check for the neurological deficit, that is tract involvement. What pyramidal tract is involved, that is the physiological lesion in that particular pyramidal lesion, pyramidal tract is responsible for the development of that particular disease. We have to check for the cause of disease, that is the pathological lesion. So in the diagnosis, we have to check for the site of lesion, we have to see the neurological deficit, and also we have to check for the cause of the disease. Then we have to do the differential diagnosis. Differential diagnosis are the different clinical conditions or the disease conditions which resembles the patient of the disease for which of the symptoms for which the particular patient is coming to us. So we have to differentially diagnose different kind of clinical condition, and we have to reach at a particular diagnosis. Then we have to do the investigations. There are different kind of investigations that are advised in case of neurological disorders. Investigations like CSF, EEG, electroencephalography, EMG, we have nerve conduction defect, visually evoked potential and radiological test. We have to check for the X-rays, CT scan, and MRI. We have to check for CSF, EEG, EMG, nerve conduction, visually evoked potential, and radiological tests like X-ray, CT scan, and MRI. So this was all about the general examination in case of nervous system, patient of nervous disorder. In the next lecture, we are going to discuss about how to count the vertebrae in case of a patient for the nervous system disorders. So this was all for today. This session was powered by Digital Version 2.0, JAYOTI Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.